cervical cancer. It's preventable and curable. We're going to tell you how. Well, we're not going to. We have a guest here who knows a little bit more about it than Dr. Weaning and I, thank God. But I'm Dr. Paul Zalzal.
I'm Dr. Brad Weaning. Welcome to Talking with Docs. We have a very important guest, a gynecologist, oncologist, so specializes in gynecology-related cancers.
I'm Dr. Tiffany Zegras.
Thanks, Tiffany.
Dr. Zegras, thank you so much for joining us and just upping the level of intellect in our show, because really we need that every third or fourth video. And you're going to tell us about cervical cancer. And this is great news that there's a cancer that is preventable,
Yep.
Almost 100% preventable.
curable, and then one day we may get rid of it completely.
100%, yes. So
Wow, so this may be a history lesson one day.
So start at the very, very beginning. For everybody watching that may not know, like, what is the cervix? What is it? How does it work? Why is it a problem?
right. So the cervix is actually at the very entrance of the uterus, or
Okay.
the uterus or the womb, where a baby would grow inside of a woman's body.
Okay.
And so there can be abnormal cells on the cervix that can be picked up through cervical screening.
Okay.
And actually these cells, the changes to the cells are almost entirely linked to a virus called the human papillomavirus, or HPV.
Okay, and we've done some videos about this before, so you guys know about HPV.
Hey, so if you're taking notes, yes, cervical cancer is almost like an infectious disease. Because if you didn't have that HPV virus, there's a very, very, very low chance that you'll get cervical cancer.
That's right, yes. And HPV is transmitted through sexual activity.
Okay.
And I just kind of want to cover what does sexual activity include, because it doesn't just mean penetrative intercourse.
Okay.
It can also be genital to genital contact, hand to genital contact, or sharing of sexual toys.
Okay.
So it can be transmitted from male to female, from female to female, or even male to male. So it's not exclusively male to female transmission through kind of conventional, sex.
Sure. And now someone's going to be saying, wait a second, this is a cervical cancer video. You just mentioned men.
That's right.
So can men get this infection?
Yes, men can also get HPV.
Okay.
Generally speaking, if men get it, it can be in the oral pharynx,
Yep.
on the penis, or in the anus.
Yep.
Now, there's actually no test to check men for HPV.
Which is problematic, obviously.
Yeah, so no screening test, I
Right.
should say. But if a man were to have HPV, let's say on the penis, they might develop something like genital warts
Okay.
that a doctor or a healthcare provider would see on the penis.
Okay.
Okay. So if a man gets HPV, I guess, and you get warts or you don't get warts, it's
Yep.
no big deal because you don't have a cervix, so you're not going to get cervical
That's
cancer.
right.
Is there any risk for a man to get any kind of cancer if they do have HPV
Yeah,
infection?
so they could get a penile cancer or an anal cancer or oral pharyngeal cancer. Thankfully, penile cancers and anal cancers are quite low.
Yeah.
There are some risk groups that are maybe at higher risk, so people like living with HIV tend to be at higher risk of
So
developing
immune compromise.
Exactly, immune compromise. So inability to fight the infection, because most of us will clear the infection on our own.
Two very famous males, actually, recently with oropharyngeal cancer. One, unfortunately, passed away, Eddie Van Halen.
No way.
Yeah, and originally they weren't sure if it was related to smoking and drinking, which unfortunately in the music world is very common.
Rock and
but
roll.
they thought it was HPV related. And then Michael Douglas, who actually
Yeah.
I think is in remission or
yes.
Yes.
cure
Yeah.
/ remission. So he had a long battle, but
Yeah, that's
was able
been going
to
on
come
a
on the other
while.
side. Yeah.
I think Farrah Fawcett was anal cancer.
Yeah, and so with HPV, it's interesting because there's like 100 different kinds of it.
Yeah,
and
many
I think
different strains.
We've talked before is that almost everyone has seen it. Like almost everyone around
Yeah.
would have had an HPV infection of some sort. Maybe they didn't know it, but
That's
they probably
right.
had
If
it.
you've ever been sexually active, you've probably been exposed to the HPV virus. Just like all of us eventually got COVID,
Yeah.
almost everybody in their lifetime will eventually see the HPV virus.
Okay, so coming back to HPV and cervical cancer, how do these patients present? Like, how would someone know, hey, I have cervical cancer?
Often people will have abnormal bleeding.
Okay.
So outside of your period or in between your period, you might have some bleeding. Sometimes bleeding with sex.
Okay.
Other times it can be pain
Yep.
or an abnormal discharge from the vagina.
And are there any times when there's nothing?
Yeah, exactly. So there are some times where people have this detected just through routine screening.
Right.
And so those people might not have any symptom at all, but on a routine screening test, we pick up an abnormality, a positive HPV test, and then maybe abnormal cells on their pap smear.
Yep.
And then we see them in colposcopy, maybe do a biopsy or a leap, and we could detect a very early cervical cancer through that way.
Now, in terms of risk factors, HPV infection obviously is
Yeah.
a major risk factor, but unlike other gynecologic cancers, this is more younger women, is it not?
It can be younger women, but also there seems to be a bimodal distribution of
Okay.
the incidence. So it tends to be kind of in the late 30s, 40s
Well, that's young
age
for
group.
cancer. Yeah.
But then also we see it again, another kind of hump, when
Mm-hmm.
people are in their late 60s, 70s.
Really?
Yes. Yeah, and that's because the HPV virus can lay dormant in the body over many,
okay.
many years.
Okay.
And so then it can kind of represent itself.
Oh, okay. All right.
And I just want to, in terms of risk factors,
Yes,
clarify
yeah.
that it's not just the HPV infection that puts you at risk, but it's actually a persistent HPV infection.
Okay.
So most people will clear the virus on their own in about 1 to 2 years, but for a select few people, they will have that HPV virus that will linger on or be an active infection for a long time. And it's that
Okay.
persistent infection that puts those people at risk.
And we've talked about this previously. The incidence of HPV infection in the general population
Is almost everyone who's
Almost
been
everyone.
sexually active,
Okay.
yeah.
So if
I
you
think
can-
they said something like in the US, like 45 million people will be, diagnosed this year.
Okay.
Very, very common. Please don't panic if you have it. I think there's a lot of stigma
Right.
because it's sexually related.
yeah.
But,
So
it's
almost
everywhere.
like you said,
Yeah.
and a good example is it's like COVID. You had
Yes.
COVID, doesn't mean you went out into a crowd without a mask or whatever.
exactly.
And then of those the percentage of those people who've had or have had HPV that go on to get cervical cancer, is that a big number, small number?
It's a small number. It's about 3% that will develop either a precancer or a cervical cancer.
Okay, 3% of people who've had HPV.
HPV
In general.
in
Okay.
general. So it's actually a pretty small number.
Okay, small percent of a big number, but it ends up being not too big a number.
Yeah, not very big a
Okay,
number.
but that's the big deal with cervical cancer, is that it affects young people as well as older people.
Yeah. And if we catch it early, we can really minimize the harms and we can completely cure you of this if we pick it up early. And that's why the screening is so important, so that we can detect these abnormalities when they're small. So basically your survival is linked to how early we catch this.
Right.
Okay.
And how early do we start like pap smears and screening for?
Yeah,
for young ones?
great question. So as of March, in Ontario at least, we're going to start screening at 25 years old.
Okay.
And we know that's pretty safe because even if those 21 to 25-year-olds have an HPV infection, they're most likely going to clear it.
Right.
And it's actually quite uncommon for a 21-year-old to 25-year-old
Right.
to develop a cervical
So
cancer.
it doesn't mean that you necessarily wouldn't have a pelvic exam or even
That's
a pap
right.
smear necessarily.
Well, you wouldn't
You
have a pap
wouldn't have a
smear.
pap for
No,
sure.
no.
Okay. So you would have a pelvic exam for maybe other reasons, but you
Yeah,
wouldn't have
exactly.
a pap
So if you had a problem, then you could definitely go to
smear. Like
your
an STI or something or whatever.
Of course, yeah. And we have to remember that screening is checking people when they are completely asymptomatic.
Right.
And so you wouldn't have a symptom. That's the whole purpose of screening.
But if you had
But if
bleeding
you have a
or an
symptom, so
STI.
let's say you even had your test last year and now suddenly you have abnormal bleeding.
Right.
That's no longer screening. Now you have a symptom. Now you have to
okay.
go see your healthcare provider because you have a symptom that's abnormal. And we need to see you and evaluate you, maybe run some tests, and then refer you on to the right specialist. And then, maybe somebody will come in and see me.
And the key to that is don't wait on that.
That's
if
right.
you have that symptom, go early to
Yes.
see your doctor, because the outcome is so closely tied to the stage of detection. So if detected early, the outcome
Yes.
is so good. Whereas if you wait on it,
Yeah.
so if you have that symptom, don't go to TikTok and figure out what to do. Go to your doctor
Yeah.
and get it checked right away so you can get treated early.
Yeah.
Okay, so let's talk just a little bit about the treatment. Obviously, with all cancers, we talk about this with other videos, there are degrees of severity.
That's right.
So can we start at the beginning with
Yeah.
the least severe to
Yeah.
the most severe and talk about the treatment options?
Yeah, for sure. So if we catch this really, really early, and
Yep.
it's what we call microscopic, meaning that I can't even see it with my naked eye, it's only seen under a microscope, then those people can sometimes, if they're very young, be treated just with a leap or a cone, meaning it's an excisional procedure on your cervix.
Yep.
And that's important for young people because they might want to keep their
babies.
uterus and have babies. So the least invasive kind of procedure that we can do, the better.
So not to minimize, but almost like a mole. Like that kind of an
it's
idea
small,
where
yeah.
you're excising the
Yeah.
lesion.
Yes,
It's not only
completely excising
diagnostic,
it.
but also
Yeah.
curative.
So those would be like your stage 1A1, we call it, in terms of, it's called FIGO staging. It's the Fédération Internationale de Gynecologie Oncologie.
Okay. Very
FIGO
nice.
staging.
Is that German? No, I'm kidding.
French.
All right. So early, you can just have that little
Remove it.
lesion
A leap,
removed,
yeah.
and you still got your cervix, still
Yeah.
got your uterus, can still have babies.
And then I'm
That's
assuming
right.
there's a specific protocol for following it afterwards to
Exactly.
make
Then
sure
there
that
would
doesn't
be
come back.
ongoing follow-up with your oncologist,
Okay,
for sure.
but no extra treatment.
No additional treatment.
Okay.
And if we catch it even a little bit more advanced than that,
Yep.
somewhere between, we call it a 1A2 or a 1B1,
Okay.
those we can still manage with surgery. There are fertility-sparing options, something called a tracheolectomy, where actually we do a bigger removal of the cervix. But for most people, if you're done having children, you will have a hysterectomy. So
Right.
that means removal of the uterus.
Okay. Okay, so, and then,
And that's often curable.
Right.
just the hysterectomy
And
alone.
no other treatment after that? Chemo,
And generally,
radiation?
no other treatment. Now, it does depend on the factors that we see under the microscope
Right.
in terms of the size. Was there something called lymphovascular space invasion? Any
Okay.
spread to lymph nodes? We often will check the lymph nodes as well. And so if there are any kind of more high-risk factors, then somebody might be required to get radiation.
Okay.
But for the most part, we can take care of it just with surgery alone. And then it's curable. Like, we are aiming to cure people of this.
Okay. All right. So next stage.
And then if we get a little bit more advanced into the kind of stage 2, that means that the tumor is bigger. It might now be kind of spread to the vagina. It might be spreading to the pelvic walls.
Right.
And once it kind of spreads to the pelvic sidewalls, we no longer can really cut around it.
Right, because you can't remove the entire.
Yeah, and we don't want to cut through cancer. So
Right.
generally in that situation, people will get something called chemoradiation. So they get a small amount of chemotherapy with radiation.
Yep.
And it's a big dose of radiation. You get a lot, you get 5 weeks of outside radiation, and you get a couple of days of inside radiation. So it's called
Okay.
interstitial brachytherapy.
Okay.
So it's directed exactly at the tumor.
Right.
And so those are big doses of radiation, and they can have some side effects on people for sure.
And this is more of a life-prolonging procedure, unfortunately, or this still
We can still do curative
Okay.
intent, but the cure rates do go down as we
course.
kind of go up in the stage.
Okay.
So I would say for stage 1, basically like somewhere between 90 and 95% of people
Okay.
are completely cured at
Wow.
5 years.
Amazing.
If we're in stage 2, it's probably closer to 70%.
Yep.
And then as we go up stage 3, maybe we're talking like 40%.
Right.
And if you have stage 4 disease, then it's
So stage 4 is distant spread. So
Stage 4
your
is
liver,
different spread.
other
Metastasis.
organs.
that's right,
metastasis.
exactly.
And then is the purpose of that like is it
then
comfort?
then
And
we're
life-
focusing on quality of life and
Right.
prolonging life. We're no longer really aiming for a cure, although about 15% of people will still be alive at 5 years.
Okay.
We do have way more advanced treatments than we ever did before
Right.
with the advent of immunotherapies. So cervical cancers can be treated with immunotherapy drugs. So usually it might be a combination of chemotherapy, immunotherapy. There might be some radiation as part of your treatment.
Yep.
But that's if you have stage 4 disease.
Okay, so if you've had an experience with this, a loved one, someone you know, or
Yeah.
you have had experience with this, leave a comment because someone else struggling with this might read your comment and
100%.
get some help from it. So we appreciate that. Now, we talked about you got it. You've talked about all the different treatments
Yeah.
and depending on the stage. We did mention at the beginning it's preventable.
That's right.
Okay.
So how is it preventable?
Oh, I'm so glad you asked that question.
There you go.
So the cervical cancer is entirely preventable, as you said, with the HPV vaccine.
Okay.
It's available to most people in elementary school. So the best time to vaccinate people is well before they ever have any sexual activity. So
Okay.
basically, in Ontario, for example, we vaccinate people in grade 7.
Right.
And we're vaccinating boys and girls.
Okay.
Boys and girls. So,
Yeah.
so if you're watching, like, oh yeah, it makes sense to vaccinate girls,
Yeah.
but why are we vaccinating boys then? Because they don't have a cervix.
Right. Well, we're vaccinating the boys to help protect the women,
Okay.
the girls from getting HPV
Right.
through sexual activity. And also it prevents HPV-related infections that boys might have. So the penile cancers we talked about earlier, the oral pharyngeal, the anal cancers.
Okay.
Yeah.
And what's interesting with vaccines is a lot of controversy, obviously, in the last
course,
5 years about
yes.
vaccines. A lot of people are going to leave a comment, no way, I don't trust the healthcare system, which we understand the trepidation. Having said that, so Gardasil is the name brand of the
That's
vaccine.
right.
Started in 2006, is that right?
That's right.
And there were 4 strains initially.
Initially,
And then now we went to Gardasil 9 in
that's right.
2014.
Yeah.
And that included really the big 2, which are HPV 16 and 18 are the
That's
main
right.
players,
Yeah.
right?
It also covers HPV 6 and 11, which are not oncogenic strains, meaning they're not cancer related. Those are the wart
Wart
ones.
ones.
So we know that we've actually decreased the incidence of genital warts tremendously as a result of the HPV vaccine.
Right, and so a lot of people are like, well, is there any reason to not get it? First of all, it's not a live attenuated virus.
No.
It's like the proteins from the outer part of the virus,
Yeah.
so you physically cannot get an HPV infection from the vaccine. I think that's the
right.
first
Yeah,
thing.
it's an incredibly safe vaccine.
Yeah, allergies and local reactions, obviously that's unavoidable with any vaccine, but generally very, very safe
Yeah.
and becoming more and more accessible.
That's right. Yes.
Yeah.
I think, well, first of all, you mentioned HPV, different numbers. So the HPV is a spectrum of infections, and they are like quite creatively named number 2, number 3,
To
number 4.
100, I think.
So there's a bunch of different strains, and
Yeah.
so they've targeted the vaccines at the strains that do cause cancer.
Yes, and if I could add, just HPV 16 and 18 are responsible for about 70%
Right.
of all cervical cancers.
Wow.
And the other high-risk strains that are covered in the vaccine cover the other kind of strains that linked. So the HPV 33 and 45 that we also know are linked probably to the other 30% of cervical cancers. the vaccine covers all those.
Sorry, go ahead.
I was just going to say that we're actually finding some research out of other countries that even just one dose, because actually generally it used to be 3 doses.
Right.
Now in our school kids, we vaccinate only 2 doses.
And it's lifelong a lot of times, right?
It's lifelong, yeah. But now there's emerging research that even 1 dose of the vaccine can be very, very effective. So even if you just get 1 dose into your kid, that would be very, very helpful.
And is there clinical evidence yet that is linking reduction in cancer rates to the vaccine, or is it vaccine?
Oh, there's absolutely evidence. So actually there was, I'm glad you asked that question. I feel like it was a plant, but it wasn't. There was a paper in the New England Journal of Medicine back in 2020 that looked at the Swedish population, and they're so good at keeping track of all of their citizens and kind of, and their registries and things like that. So they looked at the unvaccinated compared to the vaccinated, and for people that were under 17, there was a significant reduction. So out of 100,000 people, if you were unvaccinated, 5 got a cervical cancer. If you were vaccinated and you were under 17, it was like 0.1 out of 100,000. So that's like a huge reduction in the risk of cervical cancer.
So if you are someone who doesn't believe in vaccines, this vaccine is different in a few ways. One, it is directly linked to a reduction of causing cancer.
Proven benefit.
Like with a proven benefit. And 2, it's an old school vaccine. It's not the mRNA vaccines or any of the newer vaccines that people are worried about. This is like a design of a vaccine that's been used for many, many, many years, which with its established safety. So go ahead, you're still going to be against vaccines. We get it. But if you had to pick a vaccine that was safe and proven to be effective, this is one of them.
Absolutely.
At actually reducing, think of it as a vaccine against cancer.
And I think even if you have boys, give it to your boys to protect all the girls. Like it kind of protects the boys too against some things which are much less common, but you're doing it to protect the girls. So like it's like it's like an altruistic kind of way to get a vaccine.
Yeah.
Wow,
that's a lot.
That's a lot.
But it's honestly, it's such an important topic, and there are very few things that we have such control over to really stop stuff. We could theoretically eradicate it if everybody got vaccinated. So yes, please take this to heart. Talk about people. If you like this video, please like it, subscribe to our channel, and share this with someone that you think might benefit from it.
Would you be out of a job if we got rid of cervical cancer? I guess you got others.
There's other cancers, I'll stay busy. Good question. I hope that I'm out of a job because we eliminate cervical cancer.
All right. I love that. Remember, you are in charge of your own health.
We'll see you
Thank
next
you
time.
so much.
You're welcome.
That was so helpful.
Thank you for having me.